New at 4, keeping a safe distance is more important than ever, especially for the elderly or those who have already been dealing with a serious illness. But those people still need medical care and support. CBS 2's Haley Kramer talked to the medical director of St. Al's Enhancing Care Initiative about how they're helping their patients while keeping them safe from exposure.
Our goal is really to reach out to all of our patients as much as we can.
Dr. Victor Bartling is the medical director for the Enhancing Care Initiative at St. Alphonsus in Boise. It's a team of providers, a social worker, a pharmacist, nurse practitioners, nurses, and physicians helping geriatric patients navigate their disease. The same team helps providers take care of patients with serious illnesses.
It's a team approach to really improve the quality of life for both our geriatric patients and our palliative medicine patients.
Dr. Bartling says they're taking this day by day as things are constantly changing. Right now, for outpatient care, he says the team is primarily using telemedicine.
So we're communicating by FaceTime, by Skype, and other devices. It's a little challenge to get people to get things set up, but it seems to be working. And if people aren't comfortable using video conferencing, then we're using telephones.
For inpatient palliative care, they're also using telemedicine to keep an open line of communication between patients and family members who can't visit, as well as other providers. And they're working with other departments like hospice and home health, who are still doing home visits to supplement any additional needs their patients have.
We understand that the risk of going into facilities or into homes potentially could be greater than if we can see if we can manage symptoms primarily by telemedicine or by telephone calls.
Haley Kramer, CBS 2 News.
This afternoon, the Idaho State Board of Education held a special virtual meeting to decide what to do about the rest of the school year. CBS 2's Erica Lee has more on the decision and the caveat that goes along with it.
The Idaho State Board of Education voted this afternoon to unanimously extend the state's soft closure throughout the end of the school year.
I think it's unfair for us to keep our school districts, our staff, our students, our parents wondering what's going to happen. So, as you know, as the council has met, I have several times asked that we make a decision as opposed to saying we're going to extend it a week or we're going to extend it a month. I believe this is that decision.
But again, there's so much uncertainty here, and the data is shifting so quickly that I really think this proposal makes a lot of sense.
However, individual districts are given the option to choose to reopen if local conditions change, as long as certain criteria are met.
I think it's important to remember this is not, just an education issue or just the transportation issue. It's really a health issue. So it's also important that the decisions be made with the health experts beside us in aiding districts in whatever decision that they make.
The uniformity aspect of what we're doing is provided that everyone's using the same information from which to make their local decision. And if you can check those boxes and you work with your public health and they tell you that we feel good about this decision, then that's what stands.
The specific criteria is not yet finalized and will be brought before the state board next Monday. Erica Lee, CBS 2 News.
New at 4, one of the biggest challenges parents are facing right now, talking to their children about coronavirus. So we asked Meridian Pediatrics to provide some advice.
A couple parents asked me about ibuprofen and the use with COVID and kind of were nervous. And I will tell you that the American Academy of Pediatrics just agrees with the World Health Organization about the use of ibuprofen during the COVID-19 pandemic. Right now, there's not really enough evidence to recommend avoiding the use of ibuprofen unless you have, an allergy or an underlying medical condition.
On idahonews.com, you can also learn how to explain working from home to your kids and tips to protect your family's health.
Might be a little sore this morning. She was supposed to run a marathon and ended up being canceled. CBS 2's Kristen McPeak tells us how she changed her plans to still get it done.
Yeah, Brian, she's still sore right now because she ended up running that marathon. Haley Dunning lives in Boise, and she used one of our greatest features, the green belt, to not only run her first marathon, but achieve her biggest goals. She was scheduled to run her first marathon in Portland this weekend, and then that event was canceled. With social distancing in place, her family and friends cheered her on, and they documented the run along the way. She had someone run with her for the first 7 miles, and then her cousins joined in on bikes later on. She says there's no better time to take advantage of the resources in Boise when it's safe, of course.
If you have the ability to run right now, I would say for sure do it. It's amazing still being able to get outside and be able to run, and you can still keep that distance.
Now, her cousin surprised her with a video they all recorded after she finished. She ran 26 miles and she is 26 years old.